find a name tag, it's because I don't have a green form for you, which tells you who you are and what your address is, and so if you could fill out one of the green forms that's on the sign-in table. And then we have Trish Hackett.
You do your intro already?
Yeah?
Okay, just a few things. Hi, everybody. Sorry we're not downstairs. Okay, anybody new here?
Yeah,
Oh, have I got some news for you. We had a busy morning. Okay, Parkinson Support Group of the Finger Lakes has a scholarship program. It's online at Parkinson Support Group of the FingerLakes.com. There's scholarship forms for anything that you need for yourself or caregiver. The forms are in the back. I brought a folder, grab one, or you can download it from the website. This can be used, membership fees to a YMCA or another gym. We're not paying the whole thing, but we're gonna help you financially. So fill out the form. Cost-related rock study, boxing, or any other physical therapy program. Courses for Parkinson's, care partner not available through the Parkinson Foundation, Michael J. Fox Foundation, and others. So if you find something, a course that you would like to take or your caregiver would like to take, fill out the form. Reference educational manuals, DVDs. This is the important one. We've got probably a majority of our requests. Assistive devices, example, wheelchairs, walkers, canes, walking poles, bed rails, big one. Hand-reaching tools, ergonomic utensils, transfer belts. Do you have yours on? I usually drag him up here and show him off. He's not wearing it today. Okay, or other. There's other if you find something else. So you're going to be printing your name. Are you the individual Parkinson's or the care partner? Put your address, home, email. You can send it, give it to anybody with a star on their name badge, or send it to the P.O. box. All the information is right there. Our website, our website is up on top. So, but grab a form in the back, or a couple or whatever. So that's what it looks like. Go ahead, we meet, steering committee meets once a month, we review them and go from there. Again, we'll help you fund it, we won't fund it. Okay, secondly, remember last year, in memory of Pat's husband, John Paul, the founder of the Parkinson Support Group of Finger Lakes, we opened the John Paul Memorial Respite Scholarship for 2023. So we have a limited number of scholarships out of that fund. It's a respite scholarship, it's for you or your care partner. Should I say how much it is?
$100.
$100. We don't ask for anything, we don't know what you did. This is for your respite. You can go to a restaurant, you can get a bottle of champagne, or for $100, you can probably get
You can go to a spa, you can go and sit on the beach, anything that is respite.
Yeah.
And we would appreciate a little feedback about what you enjoyed. It's not absolutely necessary, but if you could just email one of us with
Now, is that on the same, use the same form for the rest of them?
no.
Did you see the email? Are
I
you
did.
on the email?
I did.
My name is on it, you send it to me, and I'll get it to the steering committee. I
Okay.
don't think we ever did a form, did we?
No,
No,
So you
so
just
just
say-
let me know.
just a request of.
All right.
Request with your address.
Mhm.
Yeah,
You
would
said
you
if
be able
you
to
had
send that
received
out
one
again,
before.
everybody? So that's called John Paul Memorial Respite Scholarship for 2023. So we'll watch for those, again, we'll review those. I put on there a deadline of the April support meeting.
Right.
So, so they're coming in. We only have a limited amount, so if you're interested, please. The people that have gotten these scholarships in the past really have fun, relaxed with them, so that's what we want you to do. Okay, we sent out an email about brand new. It's on the website, Parkinson Support Group at thefingerlakes.com. It's an equipment bulletin board. Items for sale, donated, or loaned. So I put a few things there on there already. We only opened this 2 weeks ago. We're adding things, there's some medical supplies, all brand new, sealed, if you want some of those. The contact name is there with their email. You will go directly to the contact. We have nothing to do with it except for listing it. A few things have already come off that were donated and a couple sold. There's some neat stuff on there. I have 2 more requests that just came in, and I'm trying to find out if they're donated. I would like to if they were, but also that's for sale. So look at that on the website, Parkinson's Support Group of the FingerLakes.com, and go to the bottom of the initial page, and you'll see it, and then tap on it and go in and take a peek what's available. Got more medical supplies coming in.
Right.
You said you sent out an email, 'cause I don't remember getting.
I'll have Gail send out both. Okay, to the
How do I
email.
make sure I'm on the list, because I'm not getting anything?
Okay, maybe 2 weeks ago. Yeah, let me find it, and
All right.
I'll copy it later.
Mhm.
Yeah,
That's what I'm saying, but I'm not getting.
okay. Thank you. Welcome, everybody.
Yes. So our today's speaker, I will have her mother-in-law introduce her. And just as, for people not familiar with how we run this, we do the announcements, we have a speaker for approximately an hour with give and take questions and answers. We then have a little bit of social time where you can eat some nutritious cookies and chat with people. And then we split up into care partners who will be meeting down the hall, and people with Parkinson's who will stay here, and we will share with people with Parkinson's, and care partners will share their experiences and expertise and such in separate groups. Judy Nadal.
Stu. Delighted to be here today and bring some of the help that I've had over the last couple of decades. My daughter-in-law, Tamison Kekik, is a occupational therapist with special interest in mental health and also yoga. She's got a lot of branches there, mental health and dementia. And she's been really very instrumental in my maintaining, I think, some of my mental health. Not only is she delightful company, but she seems to know just what to do to give assurance and support and succor to people who are navigating this very complicated time in our lives. So, Tamison, without further ado, love to have you here. Plus, also, I get to visit with my son and her.
Thank you very much, Judy. And thank you so much for the invitation. It's my honor to be here today. And I'm glad to hear some of you are new. Welcome. Okay. So, a little bit about me to start. I am an occupational therapist. I attended the University of Vermont and graduated in 1995 with a Bachelor of Science in Wildlife Biology. Then went on to get my master's in occupational therapy at Dominican College in New York. And then became a board certified therapist in 2014. So I always like to take a few moments just to talk a little bit about the difference between occupational and physical therapy. There can be a lot of confusion. So typically, physical therapy is a little more biomechanical. So we're looking at some of the strength, endurance, balance with physical therapists. And occupational therapy is a little more broad scope in that we're focusing on the occupations of daily living. So that could be anything from brushing your teeth, to using the bathroom, to working at your job, to attending a sport group meeting. So we really focus on what is important to individuals, and we use the primary goal of occupational therapy to enable people to participate in these activities of everyday life. So it can be in a one-to-one setting, a group setting, working in the community. So there's quite a broad scope. So I've been an OT for 9 years, and my clinical experience was a combination of home care, both in a pediatric setting and with adults. And I also did a clinical placement at the White River VA home. And that was interesting. That was a inpatient, outpatient, and we also were able to address people just walking in with various OT needs. So I worked in acute rehab at Mount Scottney Hospital for 2 years, and that was is one of 2 rehab hospitals in Vermont. Then I moved into the home care setting, working for different agencies, the Visiting Nurses of Vermont and New Hampshire, and then Beata Home Care. And then COVID came, and we all know how disruptive that was. So a lot of changes within my agency. I encountered a period of furlough when a lot of elective surgeries were cut back in hospitals. And then I was brought back to my agency, and during that time, I really started to think about how do I really want to deliver what's important to me as an occupational therapist to people in the best way possible. I started to feel a bit restricted in that home care setting, working for agencies. So I began a process of brainstorming, researching, doing some business coaching, pursuing additional trainings, so that I could then begin my own private practice at the beginning of 2022. So some other certifications and trainings that I have engaged in and enjoyed. So I became a brain injury specialist in 2016 when I was working in acute care through the Brain Injury Association of America. I pursued a 200-hour yoga teacher training for healthcare providers to be able to deliver some of the beneficial aspects of yoga to people in my healthcare practice. I'm an anxiety treatment informed professional, and I've done training in Tai Chi for fall prevention. And then Skills to Care here, that is a very big component of my current practice. So this is a program that was established by occupational therapists at Thomas Jefferson University. And its primary focus is to support caregivers who are living and caring for people with dementia. So I also just recently completed a brain longevity specialist certification through the Alzheimer's Research and Prevention Foundation. And I have experience in Reiki and some future goals. I hope to pursue another area of yoga called Yoga Nidra, also sometimes called sleep yoga. So that works on basically the state between awake and asleep. So we're tapping into a certain brain wave that can be really beneficial for pain, improving sleep, and symptoms of depression. Okay, so today we are going to talk about mental health and Parkinson. So some of this may be a review for some of you. I figure it doesn't hurt to go over a few things. So Parkinson symptoms primarily consist of both the motor and the non-motor components. And they're often common mental health diagnoses with Parkinson's, and we'll talk more about that. We're going to talk about what we can do about it and various treatment options. I'll leave some time for questions. And then we'll break, as Stu mentioned, we'll break into groups for people with Parkinson's and then caregivers. All right, so Parkinson's is the second most common neurodegenerative disorder to Alzheimer's disease that's found in the elderly population. So it can lead to a reduction in both the motor and non-motor symptoms. I'll talk about that a little more. So some terms here, bradykinesia. Many of you are probably familiar with this. That's the slowing down of movement. Dyskinesia is more of the involuntary, erratic movement, so that's a little more jerky. And then rigidity, so that's your tone and stiffness, and that can be felt in different ways. There's some different types of rigidity. And then resting tremor is another motor symptom of Parkinson's. And this results from a dysfunction in an area of the brain, the basal ganglia. And then postural instability, I think, is what a lot of people really think of when they think of Parkinson's. So some of the posture changes that begin to happen, the changes to your walking, and that can occur both while seated or standing. So, bradykinesia can often be one of the first manifestations of Parkinson's disease. It may also be presented as weakness or tremor, or maybe even an inability to speak clearly. Difficulty walking with that smooth gait, or the shuffling steps. It may present as a shrinking of handwriting, so handwriting becomes very small. And then hypomimia, which is the reduced facial expression, so a little more difficulty being expressive in the face. And then the softening speech, which is called hypophonia. Sound familiar? So, those are some of the primary motor symptoms. And I'm going to talk more today about the non-motor symptoms of Parkinson's. So some of those can present as sleep disturbances, so REM sleep disorder, maybe physically active sleep, so acting out. Care partners are probably more aware of this than anyone. Insomnia. People can experience hallucination, delusions, fatigue, apathy, anxiety, and depression are all very common with Parkinson's. So, some of the pharmacological approaches to Parkinson's, as many of you are very aware, target the dopamine replacement in the brain. So sometimes these medications can produce or cause motor fluctuations in those off times, the up and down of the cycling of the medication. So symptoms can really vary quite a bit throughout the day. And in general, over time, as Parkinson progresses, some of these beneficial effects of the medications do tend to wane a bit. So we're going to talk a little more about mental health today. And mental health is very passion of mine, but it also is so important to talk about in the treatment of Parkinson's. I'll talk more about some of the prevalence of mental health conditions, but also for care partners, because the whole dynamic, it can be very stressful. So having a chronic illness may contribute to developing a mental health condition due to the stress of having this disease. It can also be very stressful trying to adjust to this new reality, not knowing what to expect. Sometimes for some people that goes a little more smoothly than others. Challenges with having to adjust to the new physical limitations you may be experiencing. And feeling stress about not understanding treatment options. There's some gray area, a lot of gray area out there for various circumstances, and sometimes that's stressful, just not having a clear answer. And then just general uncertainty about the future and what's going to happen in terms of caregiving needs can also contribute to mental health problems and challenges. So some of the most common associated conditions with Parkinson's disease are anxiety and depression, apathy, and the hallucinations and possible delusions. So I think we all probably have experienced a little of each at various points in our lives. We know that anxiety can feel like a tightening of sensation, and depression can feel like a slowing down or perhaps maybe a loss of interest in things. So in terms of Parkinson's disease and anxiety, up to 40% of people with Parkinson's may experience anxiety. So this also can be one of the initial symptoms that present years before any of the motor symptoms present. We don't always think about that as a precursor to a different disease, but that is the case. And anxiety may increase as medications wear off, as I mentioned, at the end of a dose cycle during those off periods. For example, with Sinemet, those off times can, for some people, you may experience a little bit of an uptick in anxiety, nervousness, maybe even a panic attack. So in general, it's important if you're experiencing these things to start to think about, when is this happening? Start to try and observe cycles that you may be feeling. Maybe take some notes with your care partner, just so you can start to track if maybe that might be related to medication cycles. So some other things that may occur during this uptick in anxiety or off periods is an intense feeling of restlessness, urgent need to move. That usually involves the legs, so you may feel like you need to get up and get going. You're not sure where, but you just know you gotta go. Or a restless leg, which can, some of you may have experienced that uncomfortable feeling in the legs, and that also gives the sensation that you need to get up and go. Has anyone experienced any of that?
Of course.
All right, so different types of anxiety. Generalized anxiety disorder, social anxiety disorder, panic disorder, and then there's stress. So I did bring a lot of resources today. They're back on the back table. There's a few handouts here from the National Institute of Mental Health. I like this one. Just kind of breaking down the difference between stress and anxiety, because there's so many overlapping symptoms between the two, or experiences. So it can feel like excessive worry, uneasiness, tension, headaches, high blood pressure, changes to your sleep. So those are experienced sometimes in both stress and anxiety. But typically stress, to differentiate, is more a result of an external circumstance. So something might be happening that's temporary that could cause a lot of stress. For example, an argument with a family member. So as soon as that is resolved, stress may come down. Whereas anxiety, that's more an internal experience to an external situation, okay? So when the external circumstance may change, the anxiety does not always go away. So, some symptoms of generalized anxiety disorder. And I do want to mention this can run in families due to the biological processes involved in the brain. So it can be inherited or learned. Symptoms may fluctuate over time and worsening during those times of stress or the traumatic event. And it could increase, generalized anxiety disorder could increase as challenges with physical illness change. And as I mentioned, sometimes family conflict or relationship challenges may play a role in that too. So people with generalized anxiety disorder may feel any combination of these traits here. Startling easily, having changes to your sleep patterns, tiring easily, having headaches, maybe even a hard time swallowing, just generally feeling irritable or on edge, or maybe having to go to the bathroom frequently. So stomach problems are one of the most common symptoms of stress and anxiety. And I think we all probably can think of times where there's a real physical sensation with that. It may feel like knots, it may feel like butterflies. So stress and digestion are very intertwined. Dr. Stu could help us with that. So chronic stress, worry, and anxiety over time can impact the digestive system. The gut does contain the largest number of nerves outside the brain. And some of the same nerve connections are found between the gut and the brain. So hormones and chemicals with stress and anxiety are released into the digestive tract and can over time interfere with digestion. This can have a negative effect on some of the beneficial bacteria and microflora that we really need for our health in our digestive system that also help with digestion. So this chemical imbalance can also lead to further gastrointestinal conditions. So some common stress-related gut symptoms and conditions that may be felt: indigestion, stomach cramps, diarrhea, constipation, loss of appetite, unnatural hunger, nausea, maybe IBS, or peptic ulcers. So the neurotransmitter serotonin that's produced in the brain, that is where the primary functions are of serotonin. However, 90% of our serotonin is found in the digestive tract and in blood platelets. So of the 40 million brain cells we have, approximately, most are directly or indirectly affected by serotonin. So this could be felt in mood, sexual desire, function, appetite, sleep, memory and learning, temperature regulation, and maybe some social behaviors. So it's complex, right? There's a lot going on here. So it's really important, if you're having any of these symptoms of stress, anxiety, or GI problems, to talk to your doctor, because there could be biological, social, and psychological components to this. So how do you know if you need treatment for anxiety? If you're experiencing symptoms of any type of anxiety, it's important to sort of think about, is this affecting my ability to function? Are you noticing changes, or are you noticing as a care partner, the person you love with Parkinson's maybe is impaired by the anxiety, so that's presenting obstacles, things you maybe typically once enjoyed, or trying to participate in different activities. So really important to talk to your healthcare provider about this. So some of the things that may happen in that visit is a review of your health history to determine if maybe this is attributed to other factors or another condition, or possibly just unrelated. So I'll talk a little more about this in terms of the referral to a mental health provider. When we're talking about Parkinson, we want to be working with someone who understands the disease as well if we're treating anxiety. So psychiatrist, psychologist, neuropsychiatrist, geriatric psychiatrist, clinical social worker, but be sure to ask what their experience is with that. So anxiety treatment, further considerations to discuss with your Parkinson's doctor, other medications you might be already taking that could be contributing to how you're feeling, other medical conditions, and your doctor may be influenced by their experience, or most likely they are influenced by their experience with what works well and what doesn't work. So they may have preferences in what they like to prescribe beyond what's evidence-based. But this is very interesting to me. There is currently no clear evidence on the best anti-anxiety medication. So a lot of times we're just feeling our way with this in terms of pharmacological approach. So, as I mentioned, it's very important to talk to your doctor about it. And it's possible you may need an adjustment in your Parkinson's medications. Because anxiety can be a symptom of Parkinson's, there may be a way to adjust your medication to help with that symptom. So I'm not going to spend a lot of time talking about prescription medication today, but our primary anti-anxiety medications are lorazepam and clonazepam. And primary antidepressant medications, SSRIs, sertraline, and paroxetine. And worth noting, both can cause sleepiness or dependence. So sleepiness is a theme that will carry through here. So I'm going to now talk a little more about the non-pharmacological approaches to managing some of this and managing mental health challenges that can occur. So we all know about psychotherapy, talk therapy. There are several different approaches that can be taken in talk therapy, and one size does not fit all. So if you find that you do start working with a therapist, or you try a specific treatment approach in your counseling, and it's just not feeling like it's helpful, I encourage you to not give up after one try. You may just need a different provider or a different approach. So some of the top 3 treatment approaches that are used in psychotherapy: cognitive behavioral therapy, which involves sort of reframing the way that we think about things, acceptance and commitment therapy, and more recently used is a strength-based therapy, so really focusing on our abilities versus our challenges. So complex worry or anxiety is best addressed by a combination of working with both stress-reducing strategies, which I'll describe some more, and psychotherapy, particularly the cognitive behavioral therapy. Okay, so a real love of mine as an occupational therapist in private practice is using complementary and integrative medicine. So that is, in other words, in different terms, those are supportive treatments, okay, that are a little more, used to be called alternative, but they're coming more into the mainstream because there's more research that is very strong in these areas. Support groups. Here you are, doing what is recommended, attending support groups. This social connection with shared experiences with others is really important for your mental health. And then your habits, your lifestyle habits. So sleep is huge. Sleep structure, quality of sleep, routines around sleep. There's a lot that can be adjusted within sleep. The importance of looking at your caffeine and alcohol use, that may impact feelings, mental health symptoms, and sleep as well. And then looking at nutrition and an awareness of possibly irritating and inflammatory foods that may be contributing to how you feel. And there's more research recently into foods that may, or the relationship between food and mood. Okay, so some interesting new research about inflammation in the gut related to different types of food. And using stress management techniques. So exercise, exercise, exercise. I'm sure you hear it all the time. Mindfulness and meditation. These are very strong evidence-based treatment approaches. They can both reduce anxiety and enhance the benefits of psychotherapy. So, as I mentioned, additional stress management techniques to be used in conjunction, exercise, mindfulness, and meditation. So I grabbed this slide from the APDA. Oh, sorry. Get rid of this. Just a nice combination here of components that can be great in helping with anxiety management. So that's sleep hygiene, exercising regularly, looking at your caffeine and alcohol intake, and then some of my favorites, meditation, yoga, and Tai Chi. A lot of strong evidence in most treatment approaches. So we move on to depression. How's everyone doing?
Be alive.
Good. So depression is one of the most common health disorders in the United States. Okay? According to the National Institute of Mental Health, more than 8% of the US population had a depressive episode in 2020. I personally think that's a low number. I suspect it's much higher due to lack of reporting. But this is significant. Up to 50% of people with Parkinson's experience depression. So we need to talk about this. Depression, what are the symptoms? What might it feel like? So sadness, emptiness, hopelessness, maybe an inability to focus, reoccurring thoughts of harm and in extreme circumstances, suicide or death, and changes perhaps in eating habits, maybe even overeating or loss of appetite. So depression often can coexist with anxiety and Parkinson's disease. And typically we consider depression a diagnosis if these symptoms are present for at least a week or more. And it doesn't have to be all of these symptoms. But again, this is something to talk to your doctor about if you're feeling any of these symptoms. So one of the big reasons why depression is so common with Parkinson's is because there is a physiological basis to it. So serotonin, or one of her most important neurotransmitters, decreases with Parkinson's. So that can put people at higher risk for depression. So there's some challenges to getting an accurate diagnosis. It may be difficult to diagnose depression and Parkinson's because there's so many overlapping symptoms. So we talked about some of the non-motor symptoms of Parkinson's. They look pretty familiar over here in terms of some depressive symptoms too. So it can be challenging to tease that out and really beneficial to work with a trained professional. Sometimes people are hesitant to reveal their concerns to doctors about depression due to stigma, or maybe feeling seen as weak, not being able to manage your disease. So a whole host of reasons why people don't tend to want to address this. I think we've seen in recent years a real improvement in the willingness to talk about mental health, especially in the last decade, even more so in the last 5 years, and certainly with COVID and the impact of COVID on mental health. So, mental health symptoms can be overlooked in office visits. There's a lot to cover in your doctor's visit. And maybe that sense of nervousness and the change of sleep and change in appetite doesn't really seem like the most important thing right now. So a research study conducted by Schumann and others found that depression and anxiety symptoms are overlooked at approximately 50% of doctors' visits. Another study and research group found that 40 to 66% of people with Parkinson's reporting depressive symptoms had not been treated nor referred for further psychiatric evaluation. So we'd like to think things that are challenging us are going to be caught in each appointment, but sometimes we gotta advocate a little bit more. So it's important for caregivers and people to know some of these signs and symptoms There's a lot of similarity between both anxiety and depressive symptoms, and understanding that these are considered non-motor symptoms of Parkinson's with high prevalence is really important. So requesting that referral to, if you're feeling like you're not being heard with your doctor, requesting a referral to another mental health provider that's trained in Parkinson is really important, where you can use some of these techniques that are proven to be effective. And as I mentioned before, some of the medications are different than the Parkinson's medications. So apathy, lack of motivation, drive, and indifference. This is another non-motor symptom of Parkinson's. Maybe expressed as a flat mood, maybe interfering with activity or therapies that would normally be beneficial to you, but you're just feeling like, I'm not sure I want to do that today. So that can be really stressful for care partners who are very devoted to helping when they're trying to get you to that appointment or connect you with a provider that they feel really help you out. This can contribute to social isolation, that sense of apathy where you don't want to participate. So social engagement is super important. That's why being here is such a good thing. It's nearly as important as exercise. So apathy does differ from depression, and the primary difference is that with apathy, there's a lack of motivation, but you're not feeling that sense of worthlessness or despair or sadness. So again, best to have a more comprehensive neuropsychiatric evaluation completed if you're feeling any of these symptoms that I've mentioned so far, and determine if what you're experiencing is apathy, or maybe it's depression, or side effects of medications. Okay, so next up, we'll talk a little bit about hallucinations and delusions. This can affect up to 60% of people with Parkinson's. Hallucinations and delusions can be visual, auditory, or tactile, and they feel real. So they're actually experienced and really feel perceived as sensation, but they're not real. So sometimes it might begin as a shadow in the room and then transforms into something that really seems real. And that can be scary, certainly. It can be, so another thing to note about some of the hallucination and delusion symptoms is that can be caused by some of the Parkinson's medication, maybe sleep medication, antidepressants, and potentially relaxants. So consult with your doctor. All right, so how to treat and support a reduction in some of these mental health challenges that may be presenting, using a non-pharmacological approach. So we talked a little bit about some of the challenges, but other reasons why it may be challenging is around some of the physical barriers to accessing care. So, maybe you're having a difficult day with stomach problems, and so you're not feeling motivated to leave the house, or you're frightened of having an accident. So that could be a barrier. Transportation to the clinic may be a barrier. Lack of access or the ability to use technology to connect with a mental health provider may be a barrier. Or geography. Sometimes those services that we're recommending are just not there. So also important to try and build your mental health literacy. So just understanding what could be happening here, understanding of different psychiatric symptoms, treatment, and effectiveness. So when we look at mental health, we want to look at couples together, the care partnership, because there's a lot going on there. You're changing in your roles that you may typically have had, maybe throughout decades together. One of you was the primary care provider, and now that could be shifting. there's all kinds of ways that roles could shift here with a Parkinson diagnosis. There are changes in the needs in the care partnership. And maybe some of your favorite activities you used to do together you can no longer do. So that can be challenging and difficult to adjust to. And the changes in communication that can occur can also be really stressful and challenging. So, and then for the individual, of course, adjusting to that diagnosis of Parkinson. Trying to adjust to some of the physical changes. And then needing support. As your body changes and your mind changes, you're grieving the loss of who you used to be. So some of the other non-pharmacological treatment approaches that are recommended: occupational therapy, physical therapy, speech therapy. There's that exercise again, diet and nutrition. So the APDA, the American Parkinson Disease Association, I found a nice 8-week support group that's online. That's a psychosocial support program. So that also would be a recommended therapeutic approach. So I mentioned before some of the talk therapy treatment approaches: this cognitive behavior, strength-based therapy, mindfulness, meditation, compassion practices, and relaxation and stress-reducing activities. These are also great treatment approaches for improving mental health: massage, heat therapy, and progressive muscle relaxation. All right, so this came from the Anxiety and Depression Association of America. So I thought they had some nice tips here. So the reminder to take short breaks and breathe. So when you do this right, this can really help. So you might be asking, how do I do it right? Well, we'll practice that in a minute. Every couple of hours, stop what you're doing and do 1 minute of slow, quiet, deep breathing. So what we're doing here is engaging more of our nervous system that helps us to calm down. So that deep breathing is engaging more of the diaphragm, the large muscle, that helps increase our breath intake and can help reduce stress. Practice saying no. Trying to please everyone is too much. Exercise or do yoga. So physical activity is a great way to reduce stress, even if it's just 15 minutes. So with exercise is the release of chemicals, the endorphins, which work with your brain to trigger that positive effect. So for Parkinson's, you're getting the benefit to the motor symptoms, but you're also getting some of the psychological benefits of exercise. And then this is always a good one. Think about the things that you can control, that you might be able to adjust in your life, because with a diagnosis like Parkinson's, there's so much that you can't control. So think about what are the areas that you still feel like you have some maneuverability and choice in. And then another recommendation, listening to a guided relaxation exercise daily. So that can help in the moment, and it can also last longer, and the more you practice this type of thing, the more beneficial it can be. All right, so let's just take a moment and look at this. Relaxation. And I'm gonna have everyone pause here. We'll take one of these pausing moments. And I'm gonna have everyone breathe in slowly through their nose, very slowly. And then we're going to exhale very slowly through the mouth. So what we're doing here is eliciting our relaxation response, or supporting it. This was a term coined by Herbert Benson, who's a cardiologist in Boston. He co-authored more than 190 scientific publications and books demonstrating the mind-body connection. His primary book, The Relaxation Response, is what he wrote after observing so many of the changes that occurred with his patients with heart rate fluctuation in the doctor's office. He went on to study transcendental meditation, looked more at what was happening with yoga, and with people practicing prayer and chanting. He noticed that there were some real physiological changes that happened. So, I like this quote here, self-care is immensely powerful in its own right. The elicitation of the relaxation response, stress management, regular exercise, good nutrition, and the power of belief all have a tremendous role to play in our healing. So there's really strong evidence, particularly with mindfulness and meditation, that the more you engage in these relaxation techniques, the more you can access them. It may feel super elusive and hard to do at first, but with practice, there's some really positive physiological body felt responses. So what happens with the physiological response is we have a lowering of the heart rate, reduced blood pressure, reduced breathing rate, potentially lowered metabolism, the brain can feel calm, and you may experience an increased ability to make decisions in that area of the brain, that helps, and some evidence of increased inhaled nitrous oxide, which can be can counter the negative effects of stress. So in terms of meditation practices, there's mindfulness meditation, mindfulness-based stress reduction, compassion meditation, and loving kindness meditation. So looking at some of the studies that have been done and imaging of the brain and looking at hormones and chemicals in the body, it's been observed that using these practices can help reduce distress and immune response to stress. And the neuroimaging studies have shown an increased activation in areas of the brain that relate to emotion and compassion. So, meditation can change your brain for the better. I'm sure you all have seen and heard about the beneficial effects of meditation. There are real changes that occur in the brain as a result. So there was a study originally completed of participants in an 8-week mindfulness-based stress reduction program, and then they observed these changes that had occurred just even after 8 weeks in these different areas of the brain. So our amygdala, which is that fight or flight area of the brain that's really lit up with anxiety, when anxiety, worry, and fear is occurring, that decreases in size with meditation practices. So mindfulness meditation has its roots in Buddhist meditation known as Vipassana, which is clear seeing. So Jon Kabat-Zinn, you may have heard this name, he was the founder of the Center for Mindfulness in Medicine and Healthcare and Society at UMass Medical School. So he's written quite a few books and a real sort of guru in meditation. So what are some of the 7 attitudes and components of mindfulness? So that non-judging. So we're starting to look at how are we thinking about circumstances? Are we judging what we're doing? So practicing being an impartial witness to your own experience. Okay? Using patience and coming with a beginner's mind, remaining open and curious to new experiences. Trusting, non-striving, no expectations, acceptance, and trying to let go. So here's Jon Kabat-Zinn, and I like this quote, one of the really profound liberating aspects of the practice of mindfulness is actually recognizing thoughts and then realizing they may be true to a degree, but then none of them are actually absolutely true. I don't know if you've ever heard the, you don't have to believe everything you think. So sometimes our brain does not steer us in the right direction. So mindfulness meditation is being present with non-judging awareness, allowing those thoughts, feelings, and emotions to come and go without getting caught up. So mindfulness meditation actually is pretty similar to some aspects of Christian contemplative prayer. That quieting, the focusing, and connecting to a higher self, these spiritual practices that can help invite a sense of calm, peace, and acceptance with our circumstances. So what we're really doing with meditation is creating a space and a quiet to be able to listen to what you're thinking. Be an observer and become less connected to some of the negative thoughts that may pop up easily. For example, I'm not good enough at, you can fill in the blanks here. We all fill our heads sometimes with negative self-talk. So with mindfulness meditation, and similar to cognitive behavioral therapy, you're sort of looking at how are you thinking about this? I'm having a thought about, so it helps you disconnect a little more from the negative thoughts. There are so many studies that demonstrate the benefits of mindfulness meditation for reducing stress, symptoms of anxiety, and depression. So, some other benefits of mindfulness is it may enhance your ability to cope with distress and disability in everyday life. So some of the psychological quality of life skill measures that have been used to look at the impact of mindfulness on functioning have really shown that you can have a decrease in symptoms, in pain, in physical impairment, and those quality of life measures. And I will say, in my practice, I use a lot of mindfulness and meditation, and it's really powerful. I have a lot of great experiences with people. So, enhancing that unconditional positive emotional state of kindness and compassion towards ourselves, towards others around us. Compassion practices may help reduce that distress and maybe even decrease your immune system's response to stress. So we conclude that these techniques are effective for treating social anxiety, marital conflict, anger, and strains of long-term caregiving. That's a huge range of things. All right, so here we are, loving kindness meditation practices. So we can use words, feelings, and images to evoke loving kindness towards oneself and others. All right, so we're gonna get into a little practice here. How do we do it? You just stay right where you are. You don't need anything. And we're just going to allow our body to rest and become a little more relaxed. I've been doing a lot of talking, so maybe you're super relaxed and half asleep as it is. But just think about your heart. And when I say allow your heart to be soft, how do we do that? Just physically imagine your whole body softening. It may help to close your eyes. Just let go of any plans, preoccupations of what you're doing later, whether or not you'll get a cookie back there, or predictions on how this will go. Maybe you're already realizing this is weird. I'm not sure I want to do this. So one of my favorites that I use quite a lot for myself and with some of my clients is metta loving kindness meditation. So there's some interesting research about metta loving kindness and compassion practices on health. So we'll practice this. We're going to use these phrases here, okay? And then we're going to go through over here. We'll begin with ourself, and then we'll think of a person you love, and we'll think of an unknown person, maybe someone you can visualize but you don't know. And then we'll send this loving compassion out to maybe a challenging person in your life. Okay? So we'll begin. I'll just have you guys sit as you are. You can either keep your eyes open or close them. And you can repeat what I'm saying quietly in your head. So first, visualize yourself. May I be happy. May I be comforted. May I be free from pain. May I be peaceful and at ease. Now let's bring into your mind someone you love. May you be happy. May you be comforted. May you be free from pain. And may you be peaceful and at ease. Starting to feel a little better here. Think of an unknown person. May you be happy. May you be comforted. May you be free from pain. And may you be peaceful and at ease. And then why not send it out to someone who's a little challenging? May you be happy. May you be comforted. May you be free from pain. And may you be peaceful and at ease. And then as you're ready, if eyes are closed, you can gently blink them open. And just pay attention to how you feel after doing that. Maybe you notice nothing. Maybe you notice a little softening of the heart. Maybe it just feels good to be able to do something to help others. So mindfulness practices are determined to be an effective complement to cognitive behavioral therapy. What we just did, there is strong evidence for that in improving, in conjunction with talk therapy, symptoms of depression, anxiety, and stress. And then, as I mentioned, people who meditate, even for brief periods of time, demonstrate more compassion in comparison to non-meditators. So not only is that ability to access that sense of calm and wellness more accessible with practice, but it may actually also improve our ability to care for other people around us and be more empathetic. Okay, so a systematic review of 22 studies on the use of kindness and compassion-based practices showed these results. Decreased symptoms of depression that were self-reported, an increased use of mindfulness practices, so people found the more they did that, the more they wanted to, and increased sense of self-compassion, and an increased sense of compassion towards others. Okay, so moving along here, looks like maybe that slipped in the wrong place. We talked about some of these things, other treatment approaches that are non-pharmacological on health, the importance of sleep and nutrition. There's research showing that a Mediterranean-style diet is beneficial for the brain. So more high protein, whole grain, healthy fats, and low sugar. And that movement and exercise. And then the plan for relaxation. So I put this in here as a plan because I feel like it's really important to, these are complementary approaches, but we also want to really integrate them into your treatment and your care and your approach. So scheduling it like it's a medication. All right, so I mentioned I have experience teaching Tai Chi. There is so much research about Tai Chi and the beneficial effects for Parkinson. I knew there was a lot, but once I started digging for this presentation, it was really quite overwhelming how much research there is. Really considered one of the best exercises for Parkinson. It's an ancient Chinese form of exercise. And what's nice about Tai Chi is you get the physical movement, but you also get that relaxation response with the slow, controlled movement and the deep breathing. So research has shown that Tai Chi can improve muscle strength, flexibility, balance, and motor functioning. and it's recommended by the National Parkinson Foundation for reducing dyskinesia, bradykinesia, and the postural instability and improving walking. Wow. All right, so some resources here in addition to what's on the back table. I found on the Anxiety and Depression Association of America website, there are quite a few free support groups here. So feel free to take a picture of that if any of those are of interest to you. The website adaa.org. And then some of my resources for the presentation. And that is pretty much it. May you be safe, may you be happy and healthy, may you find peace, and may you be free. So, any questions? There's a lot we talked about there, or I talked about.
Well, one of the things is that he doesn't tell me when he doesn't feel good or anything, and most of the time when he relaxes, he falls asleep, so I can't talk.
Right.
But, like I says, we've been together almost 40 years, so
Wow, that's wonderful.
I love him and
You
he's
know
gonna
each other?
stay healthy.
You know each other well, I'm sure you're a great support.
I support him, and he's got good brain.
Excellent.
He tells me what to do or not. Or isn't that? And
Good.
he takes good care of himself. He knows when he has to take his medicine and stuff. So far, so good.
Great.